Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Which of the following organisms are associated with an increased risk of neurodevelopmental disorders? Straightforward one-liner etiology question. Which organisms are associated with increased risk? Group B Streptococcus, Escherichia coli, Herpes simplex virus, or Proteus species? So, when it comes to mental health diagnoses, there are a number of them where there is some theoretical foundation that there may be an increased risk following exposure to various organisms. There are several conditions where there's theory about that. The evidence might be a bit ambiguous or not as well defined, but as time goes on, we actually seem to have more and more information and support for the notion that a whole lot of conditions at least have some biological etiology, and infectious diseases are, of course, one of the big culprits. But here we're talking specifically about neurodevelopmental disorders. And so, as you review these four answer choices, the correct answer is clearly A. This is clear and unambiguous. Group B strep is clearly associated with increased risk of neurodevelopmental disorders. This is one of those circumstances where the data are not ambiguous. The numbers are very well defined. Group B strep is a leading cause of invasive disease in infants, is associated with both neurodevelopmental impairment and even increased risk of death. Group B strep, just in general, is associated with more dangerous outcomes. Group B strep is a common cause of meningitis. There's lots of potential dangerous consequences to Group B, but again, neurodevelopmental disorder is among them. This is different from Group A strep. Group A strep is the more common form. This is the form that is classically associated with strep throat. We know that as Group A, beta hemolytic streptococcus. And there is some suggestion that Group A strep, along with HSV, Borrelia burgdorferi, which is the causative organism for Lyme disease, and even Mycoplasma pneumoniae, which is one of our causes of atypical pneumonia, there is some suggestion that any of them may be associated with an increased risk of Tourette syndrome, of some tic disorders, but there are conflicting data on that. That's not as clear and straightforward. Conversely, the relationship between Group B strep and neurodevelopmental disorders is very clearly established. And so the correct answer to this question is hands down choice A. But just a little side note here, a little test-taking tip. If you have any question about infectious etiology for anything, and you're not sure, maybe you missed that lecture in school, or you just didn't pay that much attention, or maybe pediatrics has really not been your thing, and, that's not your area of expertise, and you might not be well-versed in all of the nitty-gritty of causation. As a general rule of thumb, you almost can't go wrong in picking strep as an answer choice. If you have questions about causation for almost anything, and there's 4 organisms listed and you're just not sure what to do, if you really don't know, pick strep. I can't promise you it'll always be right every single time, but I can tell you that the vast majority of the time, Streptococcus is the culprit. In this circumstance, clearly, with respect to the etiology of neurodevelopmental disorders, the relationship is clearly well defined, and Group B strep is the answer to this question.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.